Okay, this is the Gustilo-Anderson classification, which is really high yield. You have to know it, and I've included some other high yield topics within this, so it's going to be a little long. But first, in order to remember that, we have Gus here from the movie Cinderella. And Gus is this innocent, cute little guy, and he's paired with someone not so innocent from a different show with a different woman, but Pamela Anderson, if you remember her. Okay, so Gustilo-Anderson, it's a classification of open fractures, and it's based on the length measurement of the open part of the fracture, so the laceration length. Okay, so starting with 1, it's convenient because that's an open fracture less than 1 centimeter. Okay, so if you can see there on the left, I have like a measurement bar. Less than 1 centimeter is a type 1. Greater than 1 is a 2. And then this is where it gets kind of confusing, but sometimes people say 5 centimeters, some people say 10 centimeters. That's why the asterisk is there. So a type 3 is 5 or 10 centimeters of laceration length. And it's the 3 is subclassified into A, B, and C, so you have to know that. In order to remember that, A stands for adequate soft tissue coverage. So if you can see a laceration in the wound, there's enough skin there to just suture it closed. Adequate soft tissue coverage. It's important to prevent infection is to close it. B, 3B is for bone stripper. That's why I have Pamela Anderson here. She is representing a different side of life, and there is periosteal bone stripping or bone exposure, which requires tissue graft. Now, this is difficult because when you're asked the question, is it an A, B, or C, you can't really see periosteal bone stripping if you're just given a little tiny image. So you would just verbalize that, oh, if there's periosteal bone stripping, it's a B. C, now, is the same problem. Vascular injury is based on the clinical exam. So C for circulation compromise. C for circulation compromise. There's a vascular injury. They would have decreased pulses or a pale foot, something like that, okay? So let's review. Type 1, less than a centimeter. Type 2, greater than 1 centimeter. Type 3 is greater than 5 or 10 centimeters, okay? Type 3 is open comminuted with extensive soft tissue damage. Subtypes are 3A, B, and C. A for adequate soft tissue coverage. B for bone stripping. C for circulatory compromise. Okay, now let's get into the more advanced stuff that you definitely need to know for interviews. Antibiotics for type 1, type 2 are the same. They recommend first-generation cephalosporins. That's Ancef or cefazolin or cephalexin. Okay, so just memorize Ancef or Keflex, whichever one's your favorite. That's for 1 and 2. When you get into the 3s, you still do a first-generation cephalosporin, but you also add an aminoglycoside like gentamicin, tobramycin, amikacin. Okay, so type 3, the worst, gets 2 antibiotics. Now, a little caveat is if any of these injuries happen on a farm where there's anaerobic bacteria, high risk of infection, you also add penicillin G. So if it's a type 3, you're giving 3 drugs, okay? But only if it's a farm injury. The next high yield about this is the number of liters of saline you use to do the washout, to clean the wound in the ED. This is easy. It's the 3-6-9 rule. Type 1 gets 3 liters saline washout. Type 2 gets 6 liters saline washout. And type 3 gets 9 liters saline washout. Okay? Some people say you can add antibiotics to the saline to help. Some don't. Some say the washout needs to be high pressure. Some say low pressure. Usually I opt to say the low pressure because there's no benefit to the high pressure. In addition to that, there's the timing factor. So if the injury happened many hours ago, there's an increased risk of infection. Some sources say you need to get them on antibiotics within 3 hours, 6 hours. as soon as possible is important. You also need to check their tetanus status, and you need to, if it's a bullet wound, it's automatically a type 3. And so that's pretty much it. So there's a lot of landmark articles and literature out there that says these guidelines need to be followed based on the Gustilo-Anderson classification. So this is the basis for a lot of things. So I hope this helps you guys, and let me know if you have any questions.